News time. News time, baby.
That's right, it's news time, folks. And we're going to dive right in on this story right here because it's kind of a long one. And it has to do with one rich New York hospital got Warren Buffett's help. And this other hospital that's in the hood, they end up getting, of all things, duct tape. It has been hours since 71-year-old man in room 3 in the intensive care unit succumbed to COVID-19, a disease caused by the coronavirus. His body has been cleaned, packed into an orange bag, and covered with the white sheet. But the overextended transport team from the morgue has yet to arrive. The nurses on duty have too many other worries. University Hospital of Brooklyn, in the heart of the city, hit hardest by a world-altering pandemic, can seem like it's falling apart. The roof leaks, the corroded pipes burst with an alarming frequency. One of the intensive care units, plastic tarps and duct tape serve as flimsy barriers separating patients. Nurses record vital signs with pen and paper rather than computer systems. Patient in room 2 is losing blood pressure and needs an ultrasound. A therapist is working to calm a woman in room 4 who is intubated and semi-conscious and who tried to rip out her breathing tube when her arm restraints were unfastened. Geneva Watson, the head nurse on duty, says she relies on faith and prayer to fill the gap between the need and reality, knowing there are a higher force above, she says, gives her hope. Every hospital in New York has struggled to cope with this pandemic, but the outbreak has laid bare the deep disparities in the city's health care system. The virus is killing Black and Latino New Yorkers at about twice the rate of white residents, and hospitals serving the sickest patients often work with the fewest resources. Wealthy private hospitals, primarily in Manhattan, have been able to marshal reserves of cash and political clout to increase patient capacity quickly, ramp up testing, and acquire protective gear. At the height of the surge, the Mount Sinai Health System was able to enlist private planes from Warren Buffett's company to fly in coveted N95 masks from China. University Hospital, which is publicly funded and part of the SUNY, Downstate Health Sciences University, has tried to raise money for protective gear through a GoFundMe page started by a resident physician. Most of the hospital's patients are poor and people of color, and it gets more than 80% of its revenue from government programs like Medicare and Medicaid. Dr. Robert Fornger, the hospital's chief of pulmonary and critical care medicine, oversees the unit with the plastic tarps and duct tape. He said that he did not believe that any patients were lost because of inadequate resources, but the aged and crumbling facilities, he said, had made the job of caring for such patients much, much harder. Why shouldn't the African American have facilities that are on the same level as other patient populations, he said. When George James, a 60-year-old former public housing superintendent, arrived at University Hospital in March to have an infection unrelated to the coronavirus treated, he did not have COVID-19 symptoms. Within days, though, he tested positive for the disease. As he gasped for breath one night in his hospital bed, he panicked when he was unable to call a nurse. I didn't go to sleep the whole night because I was scared, he said. I couldn't breathe. Instead of a modern call button or intercom system, all he had was a silver bell, the kind used in hotels decades ago to summon the concierge. It was late February, and Dr. Wayne Riley, president of SUNY Downstate Health Science University, was at a conference in Atlanta when his phone began to ping with ominous message. It was becoming clearer that the novel coronavirus, which had ravaged parts of China and Italy, had begun to spread rapidly in the United States. I said, oh my gosh, this thing really does take root in the United States, then here in Brooklyn we're going to have a problem, he recalled. Not only did Dr. Riley worry about the resources that would be needed to provide care during the pandemic, he feared that the hospital's patients would be particularly susceptible to the disease. In central Brooklyn neighborhoods where most of the University Hospital's patients live, East Flatbush and Prospect Gardens have higher than average concentrations of chronic diseases like diabetes, hypertension, and obesity, which preliminary studies have shown make COVID-19 most deadly. The hospital opened in 1963, and it was meant to accommodate about 60,000 visits per year. Despite having almost no physical improvements, it now handles about 200,000 visits annually. The bunker-like concrete building is crumbling from within. Earlier this year, a leaky roof forced the temporary evacuation of premature babies from a neonatal intensive care unit. It is too old compared to other hospitals across the water, Dr. Riley said. We need a new hospital to be prepared for the next pandemic and to better serve our community. Signs inside the hospital were written in English, Spanish, and Creole, a reflection of the large number of immigrants in the area, particularly from the West Indies. Many of the patients work but are poor or receive government assistance. Many are uninsured and use the hospital for emergencies as primary care. They come to the men's shelter up the street or from a nearby home for domestic violence survivors to fill prescriptions or to have their diabetes checked. The day-to-day stress on these communities is just incredible, and that's driving these conditions, said Dr. Moro Salifu, the chairman of the hospital's Department of Medicine. The hospital has been in financial disarray for years. A 2013 audit by the state's comptroller office found that it was on the path toward insolvency. It was bleeding millions of dollars every week, the audit found, and only infusions of state money were able to keep it afloat. It has also been poorly managed. Subsequent audits found that the hospital leaders had used government money on a lavish birthday celebration in Bermuda for a consultant who had paid tens of millions of dollars, who was paid tens of millions of dollars, but who did very little to improve the hospital's finances. Dr. Riley, who became president in 2017, after the Bermuda party celebration, insisted that the limited resources had not affected the quality of care. The hospital, though, has at times been accused of violating safety standards. Last July, the hospital suspended its transplant program after a review uncovered high mortality rates and serious safety concerns. Two doctors, the surgery department's former chairman, and another surgeon had filed wrongful termination lawsuits. They filed wrongful termination lawsuits accusing the hospital officials of firing them as a retaliation for their complaints about lax safety standards. The program has since been reactivated. Even so, the hospital is vital to the community. Together with its affiliated teaching university, is Brooklyn's fourth largest employer. The university, which is part of the State University of New York system, is the largest medical college in New York City, and it produces a large percentage of the doctors working here. When the pandemic first hit the city, Andrew Cuomo, New York's governor, ordered the hospital to take only patients who had the virus. The decision ranked medical workers and others who complained about having to shoulder the heavy burden with limited resources. We're now in a situation where an under-resourced hospital is being asked to manage the epicenter of the crisis. Wow. A Democratic state senator whose district includes University Hospital, the dollars that we failed to invest years ago are affecting life and death situations now. The first patient with COVID-19 at University Hospital, a 74-year-old woman on dialysis and hypertension and diabetes, was identified on March 12th. I got the first call at 5:15, and then that was our first case. And within days, the cramped emergency room, which looks much like the same as it did when the hospital first opened, was inundated at times. More than 100 coughing, feverish patients were packed into the hallways, and side rooms are clustered around the nursing station, spewing virus into the air. The hospital came close to running out of ventilators. Julie Easton, the director of respiratory therapy, said she had to get a bit creative, and she tried to ration resources while keeping up the code to the code 99s, the term used when the patient needs to be intubated. It was just endless, she said. Code 99s would come in 3, 4 different rooms, all within a few minutes of each other, all day long. And it's just like, wow, this hospital is basically overcrowded and out of money. It's out of money and overcrowded. They need they need everything. They need everything over there. They need everything over there. As you know, we're a state facility. We don't have a lot of money, said Rose Green, a nurse who was helping to staff the unit on her day off. The hospital has begun to celebrate some success. Recently, a nurse and a nursing assistant were taken off ventilators. On April 16th, the hospital posted a video on Twitter of another nurse who had been intubated after coming down with COVID-19. She was being wheeled out of the emergency room to applause from colleagues. On a recent day, a man in his 50s who had just come off a ventilator was sitting up in his room drinking a bottle of juice. And a nurse passed by and waved excitedly. And this is a sad situation you got going on here. This is going on in New York City, the epicenter at this particular time with the place, I'll say epicenter, the place with the most coronavirus cases, actual cases that are going on. And right across the river in Manhattan, they got everything they need. Everything they need, everything they could possibly ask for, they got it. And it made absolutely no sense to me that Governor Cuomo would order this particular hospital to start taking in nothing but coronavirus cases when it was the least capable hospital to send this stuff to send these patients to. And I question that decision. And it's a real sad situation you got going on here. And Warren Buffett, if you're looking at this story, hey man, shame on you, man, for doing what you did, brother. It's time for you to just go ahead and try to help this hospital. As a matter of fact, you got enough money to build a whole new hospital. Just build a whole new hospital over there. And that's what they're dealing with over there in Brooklyn. Sad situation. This is a tale of two countries. On one hand, you got the filthy rich over here, then you got the poor over here that are suffering dearly, man. They're suffering bad. The poor people are suffering bad, and guys like just covering their eyes up, man, like you don't.
News time.
Peace.